Physician-assisted suicide. Barbara, I know you don't like that phrase. You prefer physician-assisted dying. This is, now legally, this is what, allowed in only 3 states in the United States,
it's an
right?
inaccurate phrase because suicide does not describe the decision, the rational end-of-life decision that patients are making. Specifically under the laws where aid in dying is legal, specifically it is not suicide, and so it doesn't qualify as suicide in insurance policies, etc. But beyond that, suicide is an irrational act. It has to do with mental illness. It's not a medical practice. So to label aid in dying a medical practice with the terminology of a crime is kind of like saying, well, surgery, you might call it surgery, but I prefer to call it mutilation. And I think that's a felony. You know, so mutilation or stabbing, well, no, you wouldn't call surgery mutilation or stabbing. That's a crime. But there is a medical practice of surgery, and so that's what we would call it. We would call it surgery. So it's the same thing with suicide, that assisting a suicide is a crime. It should be a crime. You shouldn't be goading or influencing suicidal people into destroying self-destructive behavior. But people who are not about self-destruction, but who are about actually preservation of the integrity, of the coherence of the story of their lives, who do not want to slip into the final degradation of delirium or unconsciousness or uncontrolled pain or some other thing that is abhorrent to them and would qualify to them as a violation of everything that they stand for. That's not suicidal.
Can you give me a concrete example of this, to take the state where you come from, Oregon? What is allowed there in what you describe as physician-assisted dying that would not be allowed in most states?
Well, what is recognized and granted specific immunities in Oregon and Washington and Vermont and Montana is that a patient who is eligible, who is mentally competent and terminally ill, can ask their physician for medication, a prescription for medication that if they were to take it, that it would cause a rapid, relatively rapid, and a peaceful death. The obtaining of that medication, as it turns out, we know from 20 years of experience in Oregon, is the pivotal event that transforms the quality of life. People feel empowered, they feel relieved of the anxiety about how they will die, how horrific it might be for them, how traumatizing it might be for their family if they want to die at home. And as it turns out, 30 to 50% of people who do go through all of those processes to become eligible, do receive the medication, don't take it. They die with the medication under their pillow, in the refrigerator. They say that was the important thing, that they achieve control, they achieve comfort, peace of mind from that, and they go on to die of their illness, usually in hospice care with palliative support.